Hello friends. It is Friday, February 7th, 2025. Sorry, I keep saying 2024 in my videos because it's, trauma. I hate this year so far. But let's talk about the bird flu update because I keep saying I'm not panicking yet, but I might be panicking now because things are getting really out of hand. And the most out of hand thing that's happened is the data that's out of Nevada. So not only did a quarter of the cows in Nevada test positive for bird flu simultaneously, not that they have that many of them, but that's still not great. But the most alarming thing is that they didn't have the same version of the bird flu that the other cows have had to date. So a quick summary of the situation. The version that's been spreading amongst cows since at least April 2024, but probably earlier, has mutated in them. That is the B3.13 clade. The other current circulating clade is the D1.1. Both of these feed up to the same genetic tree, but B3.13, which has been circulating predominantly in cows, has thus far proven to be less lethal to the humans it has infected that we know of. So all of the cow to human infections that have been of this variety have resulted in varying degrees of severe illness, definitely conjunctivitis, but thus far no human deaths. Again, that we know of. There have been other deaths in this familial group, which is why we say 1 to 2% fatality rate for this familial group. But this subset of this familial group has not had any human fatalities that we know of yet. However, the other circulating strain that is happening in birds is D1.1, and that one is a whole different kettle of fish. That one is significantly lethal in humans. The one H5N1 death that we've had to date in the United States came directly from a backyard flock and was D1.1. That was the patient in Louisiana that died in January. The kid in British Columbia who was hospitalized for 2.5 months but survived also had D1.1. But all of the cow sequences that we have had to date have been B3.13, but not the ones in Nevada. And that's a bad sign for several reasons. One, they are still at risk for spillover events back to humans, and we know that in humans, this version is not great. And two, that means there's more mammalian evolutionary pressure for D1.1. Because B3.13 has been circulating between animals and humans and other species of animals. D1.1 has circulated in other mammals, but not as many that have direct contacts with humans as cows. It also means that we're continuing to see spillover from birds to animals and back to birds and back to animals, further increasing the chance of a recombination event that could make human-to-human transmission much more prevalent in the version that is significantly worse for humans to date. So that alone is terrifying. And I think I'm not the only one that's terrified by that. New York this week ordered mandatory subtesting for any influenza A positive specimen collected in a hospitalized individual within 24 hours. Now that there is already a pretty significant escalation. But they also added this piece, requiring this for both New York City residents and people outside of New York. They also went on to state that anyone who is in the ICU with influenza A should be assumed to be H5 until the test proves otherwise, and should be treated as such, meaning put in a negative pressure room, require infectious disease protocols. Not that we shouldn't be doing that, in hospitalized patients anyway, and be given antivirals as soon as possible. They join Minnesota, Oklahoma, and California, who are all requiring mandatory subtesting. Given that the influenza-like illness hospitalization rates in several of those states is high right now, and indeed is high nationwide, higher than it has been for any year except for 2019-2020, I think that they suspect that they're missing human-to-human transmission cases. Or at the very least, they want to make sure they are not missing human-to-human cases. And we should be worried that we're missing them, because the number of states that are showing H5 detected markers is increasing. The last week it was 18. The week before that it was 15. Now we're up to 19, only 10 of which have reported infected herds. The other 9 have not. Unfortunately, we don't know from the wastewater source exactly what that H5N1 is. I absolutely think we should start doing some even further sequencing of these to see if we can figure that out, looking at genetic markers to see if it looks like it's a bird or a cow or a person. But that is suggesting that it is much more widespread than we had originally anticipated. And we don't know where. Given how it is absolutely decimating birds, the best guess is probably birds. If you see a sick bird that's behaving abnormally, do not touch it. As many states are already reporting that they are seeing it widespread in their bird population. Personally, I've seen reports of dead birds at Gettysburg College in Pennsylvania, along the Charles River in Massachusetts, in Central Park in New York. They've also detected bird flu in the live bird markets in New York City, in backyard flocks in San Mateo, in commercial flocks all across the country. There is a reason why egg prices are going the way that they're going, and it's because we are killing birds at an enormous rate, at a time when 30% of the flu tests in the United States are coming back positive. So there's a lot of circulating flu egg, which even if it has no H5N1 in it right now, very much heightens the ability for it to recombine if it does end up getting in contact with someone who has H5N1, or if you get co-infected with the two. Because H3 and H1 are well adapted to human spreading. H5 may not be yet, but if it has a chance to recombine with one of these at a time when we have record amounts of flu in the United States, more flu in fact than we've had circulating at any point since the 2009 swine flu pandemic, those recombination risks get much too high for my liking. And it doesn't help that the federal government is not publishing data. Data we pay for, by the way. Our tax dollars pay for it, it's ours. It should not be allowed to be muzzled. The CDC started resuming publishing some of its data this past week, but clearly there were 3 bird flu studies that were supposed to be included with this that have been omitted with no explanation. Who took them out? What did they say? Again, our money has paid for these studies. We pay these scientists. Why aren't they giving us this data? Who at the CDC is stopping that publication? I'll give you a hint. It's probably someone that Trump told not to publish it. More worrying still is that for a couple of seconds, there was data published before it was taken down that confirmed transmission between households, between a cat and a person, for bird flu. I would love to tell you more about the details for this, but they took it down, and I don't know. We should know. So not only is this rapid spread of bird flu absolutely causing economic harm, both to consumers through the excess prices of milk and eggs, and soon to be chickens and burgers, but it's also causing a biological threat to humans and other species. We cannot destroy the ecosystem with unmitigated spread of this virus and not face consequences. So yeah, I try not to panic. I try to have a cool head, but a lot of this is very scary and very worrisome, especially at a time when we have record amounts of flu A circulating. I am afraid we are missing human cases, and I'm afraid this is going to get much worse before it gets any better. So mask up, get your flu shot if you haven't. It may not protect you against H5N1, but it should protect you against the other circulating flus and take some pressure off of the healthcare system, which, let's be clear, is collapsing again. I've seen reports from several different states of people talking about how the censuses of their ER are breaking records that they set in the spring of 2020. There was a record number of ambulance calls in Philadelphia and in most of New Jersey this past week. Again, breaking records that they set in the spring of 2020. Those aren't good records. This is worrisome. Wear your mask, stay as safe as you can, because we are flying blind, and that's not a good thing.